most nursing jobs are not for me. It's not something I would want to be doing 3 12-hour shifts a week. Good morning everyone. It is 5:40 in the morning. I'm getting ready to head out the door, just getting my Hokas on. I really should learn how to say the name of these shoes. I mean, I love them. They have made a dramatic difference in how my feet feel. But I don't know how to say the name of them. Hokas. Getting them on so I can get ready to go to clinicals. I actually got up at 3 in the morning, taught 3 play talk grow classes. I had to cancel 3 too so I could get to clinicals on time. Packed my lunch. I packed Corey's lunch. I packed Emily's lunch because I forgot to order her school lunch. We were in the ICU when it was time to order March lunch and it got overlooked. So packed 3 lunches. Ooh, I need to change Raylan's diaper before I go too. Promise Chris I'd check her diaper and change her. But I was just thinking as I was getting ready, this is day 5 out of 7 days I'm assigned to the cardiovascular step down unit, where they get assigned usually 5 to 6 patients, depending on how severe they are. Last week she said they were short-staffed and everyone got assigned 7 patients. When everyone gets assigned 7 patients, it means they don't even have time to help each other out because everyone has more than they can handle. So that was probably a bad day. But just in general, I have not enjoyed this rotation. My preceptor, can't say she's a favorite preceptor. She's okay. She just has a very different personality than me. She's very, very loud, which gets exhausting in a 12.5-hour time that I'm there. She just has different personality. And then I just don't really enjoy the job. To be honest, obviously this is my second career, nursing. Didn't jump into this at 42 as my first career choice. If I didn't know as much as I already know about nursing jobs from having Raylan, I think I would seriously be questioning, what am I doing? Most of these clinicals, even though it's been interesting, and it's not like I just dread going in, I don't, it's interesting, but if most of these clinicals, if that was my job day in and day out, and I wasn't just following a nurse around as a student nurse, but I was the nurse in charge of these people, and I was the one that always had to like insert IVs and dress their sacrum wounds and wipe adult poopy bottoms. I don't think it's the job for me. I mean, I really admire nurses, but most of my clinicals, it's not something I would want to be doing 3 12-hour shifts a week. The exception would be my mental health rotation, where I worked at a drug and alcohol rehab center, and honestly, it was very different from most nursing jobs. There was only oral meds we were handing out, some double blood pressure checks and, general assessments of their mental health and how they were feeling related to the oral meds they were on, but it was not, they were all ambulatory. There's no trying to move large patients around and help them roll over. There was no odd smells like you would get with sick people, with puke and poop and wound smells. That's the only clinical that I was like, I could see myself here. So yeah, I would be like, what am I doing? The only reason I'm confident about getting this degree is, 1, I get to work with my daughter, but 2, that's the big one, I get to work with my daughter. But 2, even if I couldn't work with her, or let's say we found some really great nurses that wanted to work with Raylan, we want her to have more exposure to more people, so we would be good with that. We would want them to work with her, but then I would need to do something with this degree that I paid a lot of money for. I could see myself very comfortable doing home health nursing with other children like Raylan. I could see myself probably getting pretty comfortable in a NICU. And I could see myself probably getting comfortable probably in a PICU, but I'm not positive on that one. And then of course the mental health, drug alcohol rehab centers. I think I would enjoy those jobs, but most nursing jobs are not for me. And it just reminds me there's a shortage of nurses. I don't think a lot of people realize the choices and diversity in nursing jobs. I think I could be a school nurse pretty well. I think I could be a case manager nurse pretty well. If you think about what nurses do and you just think, I can't do that. Nurses do so many different things. You do have to get through clinicals and do the normal nurse job, like working a med-surg unit, but there's so many nurse jobs that do not involve a lot of bodily fluids or do not involve trying to keep straight 7 people's medical needs and get on time to take care of all of them. That overwhelms me. There's so many nurse jobs. So if you're in nursing school and you're thinking, what have I gotten into? I hate my clinicals. I don't want to do what I'm doing in clinicals 30 2 hours a week or 36 hours a week every week is a job. That's okay. You don't have to do whatever you're doing in clinicals. There are other very unique nurse jobs that might be a good fit for you. So if you're panicking, what did I get myself into? There's other nurse jobs. There's so many nurse jobs. It's so diverse. So just keep an open mind and look for those unique, different nurse jobs. Hope that helps you. Hope that encourages you if you're in nurse school and you're worried like, oh, what have I gotten into? Or if you're thinking about nursing school, but you're just really on the edge. It's a very, very diverse field. Very diverse field. You do have to get through clinicals, which is a lot of the typical nursing stuff, but you have a nurse over you. You have a preceptor. You're just more like their helper than the actual nurse. You're very much more like their helper. So you can do it. You can get through clinicals no matter how out of your comfort zone it is. And then you can find a nurse job that fits you. All right, I'm off to change Raylan's diaper and then get out the door. Skipping McDonald's this morning. I've been having horrible heartburn, so I don't think I need the extra caffeine. I had some this morning while I was teaching already, so I get to leave a little later because of that. All right, see you later.